A stroke occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or bursts. When that happens, part of the brain cannot get the blood and oxygen it needs, so it starts to die. Tips for preventing a stroke are similar to those for leading a generally healthy lifestyle.
Eating a good diet, keeping your weight under control, keeping an eye on your blood pressure, and if your blood pressure is elevated, taking the appropriate medications.
While strokes can happen suddenly, many people often attribute the symptoms to something else, like being tired or run down. But Dr. Wiggins says it's important to get to the emergency department right away if you experience any of these symptoms.
Sudden onset of weakness or numbness, particularly on one side of the body. Sometimes it's a sudden onset of the worst headache you've ever had, just a thunderclap headache. Changes in speech with confusion or difficulty getting words out. Sometimes visual changes can be a sign of a stroke.
To help remember the warning signs of stroke, think of the word FAST.
The F stands for face. If you see asymmetry in somebody's face, then that could be the sign of a stroke. If one side's weaker than the other all of a sudden. The A stands for arms, and they say you have someone hold their arms up, and if one arm drops, then that side may be weaker. That could be the sign of a stroke. The S is for speech. If someone has slurred speech or has difficulty speaking, that could be the sign of a stroke. And T is for time, because it's so important for us to know when the symptoms started.
Clot-busting drugs can help treat stroke, but only if they're given within 3 hours of the onset of symptoms. If you think you're having a stroke, call 911 and get to the emergency department right away. I'm Kevin Ryan reporting for St. Luke's Health System.